This 13-year-old patient was referred to me for endodontic treatment of tooth number 30. As you can see, large decay into the pulp. She had all the signs and symptoms of irreversible pulpitis with acute apical periodontitis. Now take a look at these roots. These were mesials were 25 millimeter long and distal was 24 millimeter long. So today went ahead and IV sedated her and did her root canal, of course, in one appointment. So what we did was cleaned out the decay, rebuild the mesial wall because we need 4 intact pulp chamber walls. 1, 2, 3, 4. Why do we need 4 intact walls? Because we don't want any saliva from the mouth to get inside of the canals while we're working, even though, of course, we use a rubber dam. Secondly, gingival bleeding, if there's gingival bleeding, can carry microorganisms and drop everything into the canals, contaminating the canals. And thirdly is that we need 4 intact walls to contain our sodium hypochlorite. Okay, so definitely when you remove the decay, you rebuild the missing wall or walls before you start the endodontic treatment. Make sure that you rebuild these walls, and when you rebuild them, make sure that they're sealed. What I do is, if I'm suspicious that whether or not they're sealed or not, I fill the pulp chamber with sterile saline and look. If I see that I'm losing volume, then I know that I'm not sealed. The walls are not sealed, and then I try to figure out which area is not sealing properly. Okay, so make sure that your walls are sealed before you initiate the endodontic treatment. I usually use self-bonding flowable composite. Sometimes I use Duotemp. Google Duotemp, all right? And Duotemp is a dual cured IRM, kind of feels and looks like IRM, but it's dual cured, so you can cure it with your curing light. As well as, of course, it cures with time. It takes a few minutes for it to cure by itself, or if you shine curing light on it, it'll make it set so you don't have to wait. And here's the post-op. As you can see, everything went beautifully. Look at these curvatures. 90-degree curvature here, 90-degree curvature here, and look at all of these anastomosis between the mesial canals. 25 millimeters, 24 millimeters. So we went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. Father, of course, she's 13, so father will take her to her dentist for the permanent restoration within the next couple of weeks.